Hello, I'm Jim Thomas, an epidemiologist and ethicist in the Gillings School of Global Public Health at the University of North Carolina. This video is on moral courage in public health. Moral courage is what it takes when ethics meets action in the most difficult places. I'm going to interview Mimi Hall, the former health department director of Santa Cruz County, California. Mimi and one of her colleagues were given a national award for courage during the COVID pandemic. Mimi, it is good to meet you. And I've heard so much about you, and now sort of face-to-face through Zoom, we get to talk, and I just feel so privileged to have this conversation with you. Can you tell me, just diving right into this, what was your position at the Santa Cruz County Health Department?
Sure. So my official title was Health Services Agency Director. And the Health Services Agency included behavioral health services, environmental health, primary care clinics, as well as the local health jurisdiction or public health department.
Okay. And it's occurring to me that some people listening to this might not know where Santa Cruz is. Can you place it on a map for us?
Sure. It's if you take a look at California and you go towards the middle of the coast, we are south of San Francisco, but north of Monterey Bay, where the Monterey Bay Aquarium is. So we're right in the center of the coast of California, and an idyllic, beautiful ocean setting with mountains not far away.
Well, so during COVID, what was your specific role during all of that was happening?
Yeah, so my role evolved during COVID. My public health background, even though I was a health services agency director and administrator, I came up through the ranks working in various public health programs, including public health emergency preparedness and pandemic influenza preparedness. So before we even received vaccines, we had weekly press conferences. And during those weekly press conferences, we shared COVID data by ethnicity, by zip code. I mean, we were so transparent. So there was no question who was being disproportionately impacted by COVID.
Who was the spokesperson in these press conferences?
It was usually myself and our health officer, Gail Newell, and sometimes our deputy health officer, Dr. David Gillarducci would join us.
So you were perhaps identified as the voice of the health department for that county.
Definitely for our county, Gail and I were the faces and the voices of COVID, because we did an update at every public board of supervisors meeting, and then we did weekly press conferences for a very, very long time. Mm-hmm. So people associated us as the county's decision makers for COVID.
So COVID was the measures, be they as simple as masks or later vaccinations, landed in a climate that was very polarized, politically polarized. And there was pushback on some of these measures. Did you experience any of that?
Oh, yeah. We experienced a lot of pushback. And it wasn't surprising. We knew that it would happen. I don't think either Gail or myself were new to the idea that there would be pushback, but it was loud, it was extreme, and it crossed into our personal lives. We had folks coming to the Board of Supervisors meetings, demonstrating in front of the courthouse, demonstrating in front of our office buildings, demonstrating in front of the clinic building where my office was located. And Gail had folks coming to her home. She lives in a gated neighborhood, and they jumped the electric gate, and she received pictures of her front door, her back door, kind of people saying, we're able to access your property. And for me, I mean, the volume of emails and letters, phone calls, I've always wanted to be a really transparent public servant. And so I put my cell phone number on my email signature. I'd always done that. I had no problem with anyone calling me at any time. Well, that resulted and a massive influx of nasty phone calls in the middle of the night, hang-ups. So I had to change that.
I have a colleague who received a death threat for his work in the pandemic. Did it get that bad for you?
Yeah, I received, it was actually 2 years ago yesterday was the anniversary of the death of one of our local sheriff's deputies. And he was murdered, ambushed by someone associated with a group called the Boogaloo Boys, just about 1.5 miles from my house. And about a month after that, I received a death threat from someone associated with the same group, the Boogaloo Boys. And law enforcement was involved, and the sheriff's office helped me do kind of like a security check to beef up the security of my home and everything. But it really scared me. It scared me because someone who was a county employee was murdered. It scared me because the person who did that also lived within a 2-mile radius of my home. So it made me wonder, like, how many people in this community are, have this kind of thinking or are anti-government. The suspect was apprehended. He was apprehended mailing another letter. And his fingerprints were on the letter. And I keep following his case. He hasn't had his hearing yet. I think there have been several delays due to COVID. But when they went to arrest him at his home, he was found with, it was something like 138 firearms,
Oh my.
homemade explosive devices, lots of ammunition, Confederate flags. And so, that was scary.
Did you consider changing the mandates, the measures within Santa Cruz because of these threats?
No, absolutely not. Absolutely not. I made it clear from the very beginning that our primary objective is to save lives. And as public servants, I never thought it would go to this extreme, but as public servants, I mean, we've all done that in big and small ways. And I'm so lucky to have had, I call her my partner. I mean, she really was my partner through all this, was Dr. Newell, because without a health officer who was steadfast and, had the same kind of resolve, and we're not superheroes. Our resolve ebbed and flowed with our personal and our professional difficulties, but we held each other up, and we filled in that space for each other and supported each other. So that really, really helped.
But still, during those many months of 2020 and 2021, in the heat of the pandemic, you stood your ground. You said no to the sheriff's office, that you could not set up a clinic just for them. You stood your ground in spite of death threats. Where did the impulse come from you? What shaped you to allow you to have that kind of a response?
I think it's something that is just deep inside every human being. Well, maybe not every human being. I hope it's deep inside every human being. But I think that there are a number of reasons why I approach my work the way I do. My personal background is I was born in Myanmar, used to be called Burma, and we left Myanmar. It's a country with the longest running civil war, 70 plus years now. And when we left when I was little, I don't think anyone imagined that there would still be the civil rights, the human rights, the genocide still going on today that was going on back then. And my parents were civil service physicians, and my father always talked to us throughout our entire lives about the reasons that we left. His belief that every human life matters and that we are all due civility and respect. And the way I saw him work both in Burma and here was he lived that in his life. And so it instilled in me this feeling, whether or not I ever went into public health. I had no idea when I was a kid that I'd go into public health. But it instilled in me this, this ethic that we all have a responsibility to each other, and we all have a responsibility to what's right and the truth. And when I was in college, when I was in graduate school, my dad gave me the book Courage by Gordon Brown.
Mhm.
And it outlines, I think maybe half a dozen or more vignette stories about people who had exhibited incredible courage, from Mother Teresa to Aung San Suu Kyi from Burma to JFK and Martin Luther King. And I read that book over and over all the time. It's, the pages are dog-eared. I have highlights and pencil marks written in the corner. And before the pandemic, I used to go to that book to give me solace and inspiration when I encountered difficulties in my work. And that really, I mean, it helped set my approach to my work.
So your father clearly had a big impact on your life, just through the values that he instilled in you, the book that he gave you, and you've really taken that to heart. And the way that is rooted in your life is so evident in how you work and how you navigated a very difficult time in the history of your county. Do you take a conscious role like that with your staff in the health department to enable them to be courageous?
Absolutely. So before I came to Santa Cruz County, the health services agency director behind me took a different kind of approach. It was very insular and kind of top-down kind of leadership. And when I came on board, I had so appreciated when I had leaders in the past, whether they're elected officials or my supervisors, who allowed me to work with courage, who allowed me to work towards the right thing. So even before the pandemic, I hope I led by example. One of the very, very contentious programs that we do in our county is the Syringe Services Program. And I found out
This
very
is
early.
syringes for injection drug users.
Correct. Yes.
Yeah.
So
Mhm.
it's a harm reduction practice.
Mhm.
And it's proven by CDC, Office of AIDS, to be an effective intervention to reduce transmission of HIV and other bloodborne pathogens in injection drug users. Very unpopular program here. And I received incredible pushback from one of our county board of supervisor members, whose district was the city of Santa Cruz, because we had a needle litter problem. Even though evidence shows that the presence of syringe services programs actually reduces needle litter, our board of supervisors had forced us through directives over the years to keep narrowing and narrowing and narrowing our syringe services program, flying in the face of CDC and California Office of AIDS best practices. So so when I came, I was like, why are we doing this? Why are we limiting exchange to one-on-one? Why are we making people prove X, Y, Z? Why I was incredulous. And I told our syringe services program staff, here's what we're going to do. We're going to share the information on best practices. We're going to start collecting data about syringe litter. We got the California Department of Public Health Office of AIDS to come and help us with a study so that we could provide facts about why these programs were actually helping our community, and they weren't the source of the syringe litter that they were seeing everywhere. And that wasn't easy. I think our staff felt the freedom to, and I invited our staff to join the presentations at the Board of Supervisors meeting on this really contentious topic. And if you didn't want to be a part of it, it was okay. But our staff felt empowered. They felt like they had leadership that was going to allow them to practice public health in the way that they knew was right and ethical. But if you don't have the top leadership of your health jurisdiction doing those things and saying, no, we're going to keep it to one-on-one exchange. We're going to limit exchange numbers to 10 each. Then what you're really doing is you're giving in to, the loudest, most influential, powerful voices instead of doing what saves lives. And that was the mantra, whether it was syringe services or COVID or HIV or our maternal child adolescent health programs. I think our entire staff knew that this is the way in which we do our work.
So the setting of the tone was not an academic exercise. It was participatory. It was live action. You took people to meetings where there was going to be contentious discussion, and you gave them license to stand up for what they felt was right. And that enabled others to be courageous in addition to yourself.
I believe so.
Yeah. Well, I can tell you, I would want to live in your county. Yeah, I think you're describing really wonderful work. I could talk with you forever. There's so much more that I would like to hear from you about your work in public health. But your time is valuable, and so we need to come to a stop. And I just want to thank you for taking the time to talk to us about this topic. And thank you for being the example that you are, and helping others to see what it's like to experience challenges, resistance, and to stand in it with integrity. So thank you for doing that.
Thank you, Jim.
Thank you for listening to one of my talks on public health ethics. If you want to learn more, you can visit the resources page on my personal website, jcthomas.org.